All right. Good morning, good afternoon, good evening, depending on where and when you are watching this live. This is the voice and the face of Dr. Tulo Lapinto, CEO and founder of Living Spring Family Medical Center here in the awesome city of Mansfield, Texas. Happy Saturday to you. Please, if you are watching live, hashtag live, and you're watching in replay, put hashtag replay. Today, we'll be doing another Facebook Live, all in the hopes of helping our patients live long and well, because we believe that the quality of life is just as important as the quantity of life. And today, we'll be talking about infertility. And the Facebook Live topic is Doc, I'm trying to get pregnant. Essentially, please help me. And we'll be talking with the one and awesome Dr. Um, Sueldo, who's yet to join us but should join us shortly. All right. Um, and so, while we wait for our guest, I would just go ahead and um, explain, why we do these lives. So these lives are done with, I'll be honest, essentially my patients in mind. I do get to, as a family physician, meet a lot of patients and meet them at different phases of their lives, either as teenagers, as kids, as infants, um, and those who are married or those who are also seeking to have children, those who have had kids who are mothering or even grandmothering or fathering and grandfathering. And so I get to meet people at different phases of their lives. And so I get to know a lot about their lives as a family physician because I grow essentially with my patients. And so one of the things that can also happen is, I get to meet them at the junction of I'm trying to get pregnant, couples trying to get pregnant. And so this life has been coming, um, and I won't say overdue, but this life has been something that has been on my heart because I know that it's a cause of sometimes stress for my patients. And so we'll be discussing ways that we can improve the chances of getting pregnant, with with as little stress as possible. All right. All right. Give me 1 second. I want to see what the hiccup is with my guest. Let me see. That's one of the joys of doing things live. All right, give me 1 second. Let's unmute. All right, we're live. And I can't reach my guest. Okay. All righty. We're going to go ahead and hopefully she's able to join us soon. I hope she's okay, actually. I spoke with her last night, but okay. So we're going to be talking today about Doc. I'm trying to get pregnant. I've been trying to get pregnant, Doc, what to do. And it's supposed to be talk with a fertility specialist. Um, and so let's go ahead. I'll start talking about some of the questions because I do get to talk with my patients first of all before I send them off to the specialist. So the first question here I had for my guest is, how long after actively trying should I be concerned about not getting pregnant? The truth about the matter is that the definition is typically about a year. And so, I have patients who come in maybe a month or two after actively trying, meaning there's no birth control or there's no means to not get pregnant. You're actively, of course, having intercourse to get pregnant and you haven't gotten pregnant. And so typically the timeline is a year. That's the time it takes for you to be um, officially diagnosed as being infertile or having issues with getting pregnant. The next questions were to be: are there ways to naturally enhance chances of getting pregnant? I'll be honest with you. There's some medical conditions that makes it pretty hard to get pregnant. things like thyroid issues. And so it's very important to have baseline lab tests done before one decides to get pregnant, or just to go for a routine physical. And that's why routine physicals are important, because there are some baseline labs that are used to check. So typical diseases that could potentially cause difficulty with getting pregnant: one, thyroid issues; two, PCOS, polycystic ovarian syndrome. We talked about that on our Facebook Live 2 days ago. And so if you didn't watch that, you could go watch that. It was very informative on how to manage PCOS. And one of the common side or symptoms of PCOS is infertility. Also, certain infections, certain sexually transmitted infections could also minimize the risk of one getting pregnant. And that's why it's good to go for routine screenings and things like that. Now, remember, it takes two. So before I typically send my patients off to a fertility specialist, I ask, has the person you're trying to get pregnant with, meaning your male counterpart, have they gone to check? Have they fathered a child before? Because, and I say this because the workup for a woman is pretty invasive sometimes and also pretty expensive, it is important to make sure that the man also is able to father a child, or doesn't have any issues as far as sperm count and things like that. So typically, before I send a patient off to go see a fertility specialist, like the guest I was supposed to have today, I typically would say, has he fathered a child before? Have you been pregnant before? Before we do the whole workup as far as testing for the woman. So it's really important. Remember, it takes two. So to ask questions about the male's health, maybe have him go have what we call a sperm evaluation. And there are ways to do that at several clinics where the ejaculate is actually tested to see if they're viable sperms, meaning sperms that are able to swim really well and swim really fast, or if there are enough of them. All right, because remember, a sperm has to swim to the egg for a pregnancy to actually take in. So really, really important. And so I tend to recommend. Now, of course, sometimes that conversation is tough, like, oh, you need to go check. So we got to make sure it's not your fault. Remember, the two of you are working together. So it's your fault that we're not pregnant, or it's a joint effort. And so it should be seen as a team effort. So I typically encourage my female patients who are having this concern to gently nudge the partners, either come see me and we can have that discussion, or to have them go see their primary care doctor, for evaluation. Okay, so remember, it takes two. We talked about medical conditions that can minimize the risk of getting or decrease the chances of getting pregnant. And we also talked about certain infections that can also be an issue. Okay. Now there are many other issues or many other potential causes of difficulty with trying to get pregnant. I really wish my specialist was here, but I've had patients who have had issues with either they've gotten pregnant quite a few times, but the pregnancy didn't stay. Sometimes we have people who have what we call cervical insufficiency. What is that? Well, remember the cervix. Let's talk about the cervix. The cervix is actually what dilates, meaning it's what goes to 10 centimeters before it's, when someone's pregnant, we say it's time to push, right? So sometimes the cervix may be a little bit short, and so it's not able to keep a pregnancy in. And so that could be a cause. And typically with those patients, you have recurrent pregnancy losses. So they get pregnant and then pregnancy doesn't stay. That can be frustrating. I can relate to that. I've had quite a few myself, but the cervix is the issue, but there are procedures. So the whole point of these talks are to give people hope, not false hope, but informed hope. Meaning we can have discussions and ask questions about, okay, why is it? And what are things I can do? When should I go see a doctor? So, sometimes it's a matter of maybe fixing the thyroid. Sometimes it's a matter of, your cervix may be a little short. So let's do things in anticipation of the next pregnancy. So that way we give the cervix a little bit more support during the pregnancy. So depending on what the cause is, there is potentially a solution. So I'm encouraging you, if you're watching, you can say, I've been trying to get pregnant, please, make an informed effort, meaning seek out help, go see your primary care doctor, get baseline tests done, and things like that. Okay, so we talked about cervix, we talked about fibroids. Now, I want to caution here, not it doesn't mean if you have a fibroid you cannot get pregnant, because I know that's been a big concern. But having a fibroid, if you think about it, depending on where the fibroid is, could potentially cause issues during the pregnancies. But the truth of the matter is, most times fibroids are found incidentally. So just because you have a fibroid does not mean you cannot get pregnant. So don't make that assumption. Fibroids are pretty much extra tissue of the uterus. What's the uterus? That's the womb. That's what houses the pregnancy when someone gets pregnant. But sometimes that muscle, that uterine muscle, has extra balls of tissue. And so those balls of tissue can get really big and make the space of the uterus, so the space inside the uterus, not have enough space to kind of house a growing baby. And that's where it becomes an issue. But most times fibroids are small. They're actually found when people go for ultrasounds for the pregnancy. Oh, there's a fibroid there. So like I said earlier, having a fibroid does not mean you can't get pregnant. It may just mean, especially depending on the size of it, there's certain cautions or precautions need to be made. I still haven't heard from our guests, but we'll keep going. Thank you all for staying with me. All right. Now, what are things that can reduce the chances of getting pregnant? I really want to talk about this because as a family physician, one of my biggest passions is to help prevent issues, and sometimes that's tough to appreciate, right? You're like, well, it may not happen to me, but let's help make sure it doesn't happen to you. So what are things we can do to enhance when you're ready to have that baby? What are things you could do to enhance the chances of getting pregnant? Number one, if you smoke, please stop. I know that's sometimes a challenge because it's a habit, and habits takes another habit to undo, but it is possible. But smoking is one of the things one can do to reduce the chances of getting pregnant. So if you smoke, please, there are things that can be done to help minimize the craving. So that way you're not as obsessed or driven to smoke. But that's one thing. Number two, we already talked about some of them, certain medical conditions, so thyroid issues, also history of sexually transmitted diseases. So please, I am also an HIV specialist. I've had to give a couple of patients actually, some bad news about being HIV positive, but sexually transmitted disease like HIV, like chlamydia, like gonorrhea, those minimize the risk of getting pregnant. Also, this is not a weight bashing live, but it's typically harder to get pregnant depending on weight. So the more obese the patient is, the harder it is to lose weight. I've had patients actually who by losing weight actually got pregnant just by doing that. And so that's also, it's important to maintain a healthy weight as far as increasing the chances of getting pregnant. All right, when is the best time to have sex to increase the chances of getting pregnant? All right, this is a very, very good question. I get this quite a bit. And there's an ovulation window that is recommended for patients to actively have intercourse to increase the chances of getting pregnant. Typically, it's a few days before till a few days after that ovulation window. And one of the things I would tell you, so you could know and actually know what your ovulation window, meaning when your periods are more likely to come, when they're more likely to stop. One of the things that's very important is for you to actually have a tracking system, because you want to track, when did you have your period last time? When did your period end? So you start to have some form of a way of predicting when your period is going to start, when it's going to stop, because your ovulation window is somewhat related to those dates. Okay, so there are different apps. Many of them are free. I actually recommend a few of them for my patients who are actually using it also as a way to ironically prevent pregnancy, or know when their cycles, or when it's less risky, I guess, to have intercourse. So there are many apps. Many of them are free. I believe there are actually 2 or so FDA approved apps that you can use to really, if you're, now, of course, I know we're talking about pregnancy prevention, pregnancy increasing the chances of pregnancy. But these apps are used also as a way or a form of birth control or family planning. Okay, so they're free and you can just download them on your phone and track privately. Okay. Um, Myths. I was going to discuss this with the specialist as far as what are common myths that people have surrounding pregnancy, about, if you different positioning during sex increases the chances of getting pregnant. Uh, there's no scientific backing to that. It doesn't matter what position, whether the man or the woman is in, as far as getting pregnant. In relation to twins, I'm Nigerian American. I've said that before. Nigerians actually have one of the highest rates of twinning. I don't know why. Don't know why. If she was here, I'd ask that question too. But twins are very common. Certain parts of the world where there's a higher rate. If there's a family history of twins in the family, then there's a higher chance of getting twins in pregnancy, both on the male and the female side. I can't tell you what to do to increase the chances. However, if someone is getting fertility treatments, all right, if someone is getting fertility treatments, IVF and different types, there is a chance of multiple pregnancies happening at times. So that's when you would have gone to see the fertility specialist, or what we call a reproductive endocrine specialist. And that is someone who you would see when you've been actively trying to get pregnant. The man has gotten evaluated and checked out like no issue, or maybe there's some issue, and then the both of you go together to see the specialist to decide, okay, what's next. One of the options is the in vitro fertilization. So there's a higher chance of actually getting pregnant in multiple folds, or duplicate. I don't want to say duplicate, but having multiple pregnancies at the same time. So there's a higher chance of twins and triplets and things like that. Okay. All right. Someone asked a question. I knew someone was going to ask the question on what is the app to track. I have it here. Give me 1 second. I'll pull that up. I have it saved. Now, those ones typically are not free. Okay. So one is called NC, Natural Cycles, and it's FDA approved, meaning it's been tested. It's been approved as very accurate. Okay. So it's called Natural Cycles. I don't believe it's free. All right. But it's FDA approved, and it'll tell you in simple terms, based on, you get based on it, it'll tell you when you're not fertile, when you're fertile. Of course, when it says you're fertile, that's a good time to have intercourse. So it's called Natural Cycles. That's one. There's another one. Give me a second. Brand new Natural Cycles is one. There's another one. Natural Cycles. There's another one. But that's what I would recommend to use. And I like the fact that it is non-invasive. So it's called Natural Cycles. And that's something that you could use to track. Okay. All right. Next question. This is really important. Oh my goodness, this is what caused my inability to get pregnant. One of the most common one is birth control, where people feel like, oh my goodness, it's because I was on birth control that I'm not able to get pregnant, or so that is very, very unlikely. And it's really, really important to kind of think, and I know that there's a lot of emotion surrounding trying to get pregnant and the difficulties with it, but I want to encourage you, if you're watching live, replay, that doesn't help. Okay. Oh, I did this in the past. That's probably why. It doesn't change what's happening right then and there. And high stress level also also decreases the chances of getting pregnant. And so, one, there's no scientific data saying that having had birth control in the past minimizes the risk of getting pregnant in the future. That's not founded on scientific data. So I want you also to be cautioned with the blaming game, or it's because you did this or because you did that. It's what can I do based on what's happening right now to increase my chances of getting pregnant, right? And so it's from that mindset you move forward. And so that cohesiveness is very, very important, especially during this delicate time. I hope this has been helpful. I really appreciate it. I wish I could see your faces or know who's live so I can appreciate you. But thank you to the LinkedIn user who asked that question. That was very, very good. And thank you for watching. I'm hoping that I can actually have my guest on at a later date. We'll iron out the kinks. I'm not sure what happened, but I thank you for watching. I hope this was helpful. And I will see you on our next live. Thank you. And if you or anyone you know is looking for a passionate, a thorough, and a compassionate family physician who helps patients live long and well, please refer them to me. And have a good one. I am She. Bye.